There has been a lot of talk about the mental health crisis facing Americans right now. No place in our country is exempt. Rates of anxiety and depression are at all-time highs everywhere and in every age group, particularly since the pandemic. Today, for the first time in history, a U.S. medical task force is recommending that adults under the age of 65 be screened for anxiety. Anxiety disorders are the most common mental health illness in the U.S., affecting 40 million people. It almost always goes undiagnosed. One study says the median age for initial treatment is that people wait a whopping 23 years before they get help. 23 years. Back in April, the task force made a similar recommendation to begin anxiety screening in children from 8 to 18. This was after emergency rooms across the country were overwhelmed with kids admitting children suffering from mental health crises and nowhere to put them. Joining me tonight are two doctors who are the tops in their field on this subject: psychiatrist Dr. Gail Saltz and president of Summit Ministries, Dr. Jeff Myers. First, I want both of you to react to this recommendation today. What do you think? Gail, you go first.
Well, I think this is a great recommendation because indeed it is true that this is vastly underdiagnosed. It's the #1 mental health issue in the country. And without recognition, obviously, these people will never get to treatment. It is a highly treatable disorder, but untreated, it leads to, in addition to a ruined quality of life, it leads to clinical depression. It can lead to other health issues, high blood pressure, peptic ulcer disease, chronic pain. So it's really important that we discover these people. On the flip side, however, I will tell you that while this is an important piece of the puzzle, where are these people going to go for treatment? I will tell you right now that two issues exist. One is that mental health providers, we are overrun. There are not enough of us, and there are very few appointments remaining. And so I have a lot of concern about where these newly diagnosed people will get treatment. And there's tremendous burnout for primary care physicians who are now going to have another thing on their plate and are already burnt out, and for mental health providers who are burnt out as well.
Right, Jeff, actually, Gail brings up a good point. I mean, I saw a statistic recently that said, I think in 70% of counties in the United States, there is no therapist specializing, for example, in this case, in adolescent anxiety or depression, mental health. In other words, we don't have enough therapists and doctors to treat this. We also know that for most people, anxiety begins around the age 11 and that they don't, get any help for it for 23 more years. I mean, is this a promising development, or is this just going to expose how bad the problem is when it comes to treating it?
Well, it certainly can expose how bad the problem is. And Gail is exactly right. In some mental health screenings, 90% of young adults who were screened for moderate to severe depression. 90%. Just try to imagine that. But there's a social aspect to this as well, Elizabeth, that a lot of times I think needs to be brought into the discussion. If we just medicalize this issue, then we're ignoring the fact that 75% of these young adults also say they do not have a sense of purpose that gives them meaning in life. Half of them say they regularly struggle with anxiety and depression. At Summit Ministries, we work with about 70,000 young people every year. Now, most of those are not in counseling situations. We're helping them strengthen their worldview so they can be well prepared for college and be resilient. But the students are telling me, I feel like I'm at war with myself. And there's a social aspect to this as well that I hope we get the opportunity to talk about on the show, because every young adult is asking the question, am I loved? Why do I hurt? What is my purpose in life? How can we all get along? There seems to be so much anger in our society, and where's the hope?
Right, those existential questions that a lot of people struggle with. But I think with today's recommendation for adults from ages 19 to 65 in this recommendation, I was really struck by the fact, Gail, that only 40%, less than half of people with anxiety get any type of treatment. And here's the funny thing. I mean, not funny. It's just, I found it very, I'd like you to answer why. 26% of men suffer from anxiety. 40% of women do. Why do we see such a gender gap in that?
Yeah, we do see that gender gap. It's true for anxiety disorders. It's also true for major depression, for clinical depression. Twice as many women suffer as men. And there are different kinds of disorders that men suffer from more often than women, like substance abuse. But when it comes to this gender gap of anxiety disorders, we have to look to various issues. They range from biologic issues, and men and women have different biologies. So when this gap really increases post-puberty. So something about hormonal differences may play a role. We also have to think about cultural issues that impact women as opposed to men. So women these days, right, we're expected to, frankly, do it all. Be the primary caretaker of the home, of the children, and work. And what exactly is our role? And so I think that the pressure that women are under culturally is somewhat different than men. And you put these two things together, and there may be other factors as well that we don't know about, but these seem to be real issues. And it's important because also the number one reason that people really don't seek treatment is stigma. So that is something we've been working on.
I was actually going to say, people are, I've been very open about the fact that I wrote a book about anxiety. I have a child who suffers from anxiety. And he talked about the fact that he was embarrassed to admit that he was anxious, that there's something embarrassing about being afraid when nobody else around you seems to be sharing that fear. And the fact of the matter is, we can help,
We
with
can help
drugs,
them. Remember,
with CBT.
there is a biology to these illnesses. This is, we help remove the stigma when we help people understand, yes, there are the issues that you're speaking about who am I and existential issues, and they play into anxiety. But an anxiety disorder is a medical illness. It is a brain illness. And we have to remember that when we're thinking about who we're referring for treatment and how we're treating them. And therefore, you wouldn't stigmatize someone if you said, oh, I'm sorry, but you have diabetes, or, you have cancer.
Exactly.
We have to treat this.
This is a big issue. We'll have you back, both of you, because I'd like to talk to you more about this. It's so important. Dr. Gail Saltz and Dr. Jeff Myers, thank you so much for being here.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.